Hello friends, welcome back to my channel. Today I'm going to continue the part 2 of the professionalism. If you haven't watched my previous video regarding the professionalism, I would highly recommend you to go and check it out first, because that is the first part of the professionalism which I started from introduction and I lead down to the professionalism of patient physician relationship. As we all know, I was talking about the good practice before, so this is one of the first topic of the good practice list. Let's get started without wasting any time. So the second part is the professionalism in a collegial relationships. Let's talk about relationship with our colleagues. Physicians who exhibit disruptive behavior can adversely affect the safety of care by causing colleagues to fear interacting with them. This fear can lead to development of unsafe work around and deviation from standard of care, policies or procedures. So let's take in a way that if we are working in a team and there is a physician who is maybe senior resident or a supervisor, their behavior is not very favorable in terms of junior residents or any other person in the team, they might be having a fear to interact with them, and that will really makes a big difference in the safety of the care, especially if both of the team members are involved in the circle of a care of a patient. Professionalism in a collegial relationship implies assuming responsibilities for our own behavior or role in any conflict with the colleagues. In professional relationships, colleagues are treated with respect, and all communication, whatever the medium, is contagious, dignified, and respectful. So that means if someone is talking in a circle of care or in a team member, everybody is responsible for their own behavior. Whatever the mode of communication, it's a virtual mode, it's a in-person mode, it's a phone modes, anything, but they should be having dignified, respectful, and in a very respectful manner. Let's talk in a way that if someone is to promote the collegiality and the healthy workplace, incivility is not tolerated and is adversely addressed early and justly. What does that mean is, if someone is not behaving very well and it is not tolerable, then you should address it as early and as the same way as it is. I'm going to just open this link to just let you know what the justly means. So justly means is the culture, basically. So culture is what kind of culture, what kind of workspace you are working, that they're gonna tell you how to tackle or how to improvise or address the things which are not tolerable in that workplace. So we are going to discuss that topic. This is also one of the part of the professional not professionalism but the good practice, but we will do it in the later videos. Team collaboration and shared accountability is fostered. Formal and informal mentorship and leadership opportunities are promoted. This is the simple thing. If you're working in a team, if you're working with your colleagues, you need to make sure what your behavior looks like, how you are communicating, how much you're respecting. It does not matter it's a senior or junior or a physician or a junior resident or a medical student. Everybody in that workplace has to be respected, and if there is any kind of non-tolerable behavior is happening, that should be addressed as early as possible, and that kind of culture should be promoted. Next is professionalism and advocacy effects. Advocacy is an important role of physician who are expected to advocate for the well-being of communities and population by striving to improve health outcomes and access to the care, reducing health inequity and disparity in care, and promoting social accountability. As we all know that as a physician, we are not just responsible for dealing the sign and symptoms of the patients, but we are also responsible for advocate. We are being as an advocate, we have to promote the well-beings of the community. Let's take health promotion as a topic. Someone is doing cigarette smoking, so we have to advocate them that what are the health outcomes can happen if you are keep continuing your smoking, or how can you improve it, what are the things you can get the access while you are in the healthcare system or you are engaged into the community, and reducing the health inequity. Definitely, if we talk about inequity, it is one of the most important fundamental element for our standard of care. So we need to make sure that inequity is being reduced as much as possible, and what kind of care you are giving, and socially accountability. That means you have to promote the things which are socially available for the community. In so doing, professionalism requires thoughtfulness, restraint, diplomacy, and consideration. The ease of use and uncensored nature of social media platform can make the publication of unprofessional, hurtful, defamatory, or threatening comments too easy. So that's this is they are talking about the social media platform. Even though social media platform is a very good way of putting a lot of things which are knowledgeable, which are very good for the community, but at the same time, at some point of time, they might counteract and they might give you some kind of hurtful or unprofessionalism. So that's why they are talking about. But the advocacy should be goes on. It should not be uh, limited to this social media platform. Physician must be mindful of the impact of their comments to on their patients, colleagues, employer, or the healthcare system at large. Physicians recognize the social determinants of health, and the profession expect responsibility to act in a way that promotes public health and population health, health education, environmental determinants of health, legislation affecting public and population health. This includes collaborative and respectful relationship with all communities and efforts to understand and implement the recommendations relevant to the healthcare made by the Truth and Reconciliation Commission of Canada. Here, if we talk about the advocacy efforts in terms of professionalism by a physician, then we are talking about the social determinants of health. There are multiple social determinants of health, from socio-economic, from healthcare access, from the discrimination, and where the community is, it's urban or rural, what the access looks like. So all of the things has to be determined or recognized by the physician, and they have to take a responsibility to promote the health of the population or public, the providing the health education, giving the environmental. Let's suppose if it's a summer, winter time, it's a winter time, what are the things has to be modified in a way that we are addressing the social determinants or determinants of health, and the legislations that affecting the public or population health. So all of these things are comes into the advocacy part. This also includes, one of the most important thing is how our relationship with our communities, because usually the advocacy part is always go into the health of a community, health of a population, health of a group of peoples, and what are the efforts we are putting to recommend the things which can be made, especially if the truth and reconciliation, this is also the most important thing. Definitely I'm not going to talk about it, but these are the things where they are talking about what are the things has to be changed and how we can improvise it to make sure we are providing the good equity to everything, especially if we talk about the healthcare access. Physicians contribute individually and in collaborations with others to improve healthcare services and delivery to address the systemic issue that affects the health of the patient and of population, with particular attention to disadvantages, vulnerable or underserved communities. So as we were mentioning about the public health, we are talking about the population health or a group of people. We need to make sure we try to put or address some of the issues which are coming into the systemic issues. Systemic issues could be anything. It could be related to screening, it could be related to the not involving a particular group of peoples, it could be related to anything which is on the system level, it's not at the individual level. So as a physician, you can advocate those things, you can put your efforts to make sure that you address and improvise those kinds of healthcare system wherever it is possible, and address that issue on the systemic level. Either the problem is at the system level or providing a solution at the system level, because once the system level is being involved, it is easier that every individuals can follow the policies and the guidelines according to that. So that's the one thing we can do as a part of our advocacy. The fourth thing is professionalism, respecting self. We have been talking about everything which is in our surrounding. Let's first take patients, then we talking about your colleagues, our team members, then we started talking about the community where we are working when we are providing our care. Now let's talk about our own self. Let's stay on our own boundaries and see where we are and how we are trying to be professionalism in our own self. The increasingly busy and demanding Canadian healthcare system environment has led to an unprecedented rise in the level of the physician burnout. There is a growing recognition that physician stress is also related to conflict between the professional commitment to always put the needs of the patients first and daily constraint providers face, which are beyond their control. Simple definition is, we can say physician burnout. Why physicians are being burned out? First thing, they have to put the needs of the patients first in every step. Secondly, the load on the physician in terms of how many patients they are seeing, how many work they are doing, and what are the stress level of that physician is, and what are the things which are making them to restrict from what they can do or what they can provide. All of these, some of them are beyond your control, and all of these things really contribute the physician burnout. Providers are constantly balancing patients' needs with the lack of resources, technology challenges, financial constraint, and productivity metrics. This creates a double bind of being expected to focus on patients' health while not having the system support to do so. So let's take this example as a case that you are working somewhere in a rural community where there's a small town which is around 500 to 1000 peoples, and you are working in a small community hospital or a center where you do have a resource of a chest x-ray, you do have a resource of a small amount of blood test, but you don't have a resource for a CT scan or for maybe MRI, or maybe having an specialist present there at the time when the patients need it. Or maybe there are some technology issues coming up and there is no internet, the weather is bad, the computer system crashed, the EMR is not working, and all of these things has to be balanced in a way that you still provide the care. So if any type of this situation comes, we go back many years and see, okay, at that point of time how the physician was providing care. So that's, nowadays it's very difficult to say that okay, we don't have CT scan, but we will be able to say that okay, this patient is going to be having this and we are going to treat in this way. So that's why they are saying that if any of these things are coming nowadays, then it's really creating an unexpected, or we can say a situation where we have to focus on patient's health still. Even though we don't have support, we still look at the patient and we will see what the patient wants. Is the patient is in severe pain, we don't have CT scan, let's give him some pain medications and we'll go from there. If the patient is in a cardiac arrest, we don't have a AED, we don't have some kinds of monitoring, there is a power outage or something happened, still we can do the CPR because we know patient is not in a good state right now, he is sick. So that's the thing they are saying. Whatever happens, if you have the support system or if you don't have the support system, our expectations are always to focus on patient health, in person patient health, what the patients looks like. So that's the thing they are talking about, and that's definitely difficult. And when you talk about your own self, then in these situation it's very tough at some point of time. So this is the main thing, that where how you can put your professionalism in yourself and what you can do. Moral distress can result from these competing forces, and over time moral distress can become moral injury and burnout. So this is the one thing which you can say, that if these are the things happening every day, you have been working in a community and there are lots of things which you need but you don't have for any reason, intentional reasons or unintentional reasons, we don't know. But if you stay in that environment and you are trying to focus more on patient's health with the limited resources, at some point of time it will make a distress and it will make a burnout for the physicians. So while individual physicians are accountable for making choices and adjusting their practice to optimize their wellness, physician wellness must also be promoted at the system level. Nowadays we don't just talk about patient's wellness, or we don't talk about the standard of care surrounding the patient, but we always talk about how the physician is well. Is the physician is doing well? Is the physician need any help? Is there any way we can support physician in terms of stress? So these are being promoted at a very high level and a system level. Wherever you work, wherever you are doing job, or wherever you are working in a healthcare system, you always have a physician wellness program which will help you at the systemic level wherever you need. So it is an imperative to devise the healthcare system that supports individual choice to prioritize personal wellness and work-life balance, such as accommodating requests for the work fewer hours where possible. So one of the things which I have learned, that if you want to release or decrease the burnout, make the shifts shorter, because it really helps a physician to have a work-life balance. And once they are in a work-life balance, they have been more productive on their work and their burnout level goes down. So that's the one thing. Let's suppose if you want to take a request that okay, I don't want to do 12-hour shift, but I'm okay to do 8-hour shifts, so that can also be prioritized when you are being on your personal wellness. And that's the one thing which can come into the physician wellness one thing. So the development of policies that encourages provider to seek help for themselves without fear of repercussions is paramount. The development of policies that encourages provider to seek help for themselves without fear of repercussions is a paramount. So whatever type of policies you want to develop, or you are trying to develop, that should be encouraged. You don't have to fear, okay, if I say this might be not happening, if I say this might be counteract me. So that's the one thing they are saying, that it is the paramount, it is the fundamental, that providers are prioritized on the basis what they feel they can make sure that they have a very work-life balance. To foster collegial workplace, just culture that promotes psychological safety should be cultivated. We will be reading these two topics, and it might be more clear in that part what the professionalism for our own self looks like. Addressing the systemic failing may be the most important solution to the moral injuries among providers. Sometimes, as we were mentioning, like our resources, so this is not an individual fault, this is not at the lower level in the system, this is at the higher level of the system. So if you are trying to address that, definitely it will decrease the level of your moral injury, and it will increase the support system, and more the things will be more clear in terms of providing a standard of care to the patient. There is a mounting evidence that physicians burnout can threaten patient safety. Why I'm talking about physicians burnout? Because if you are not in a good state of uh, physical or mental health, then you might not be able to provide a best care to your patient, and that can lead to the safety of the patient challenging. Burnout can lead to depersonalization. What is the depersonalization? Development of a negative and cynical attitude towards patients and their concern. So what they are saying is depersonalizations means you will be having a developing a negative kind of attitude towards our patients and their concerns. You don't feel anything, you don't have an empathic approach, you don't feel a kind of attentions towards the patient's concerns or mere their sign and symptoms, and you might take a decision which is not good in the safety of the patient. And lack of empathy and poor memory, decreased attention, poor clinical decision making, all of these things can be happening just because of physician burnout. Burnout can also lead physician to leave medicine, resulting in decreased access to the care for the patients. An important component of professionalism is thus to commit first to self-care, personal health and wellness, and making efforts to balance professionalism and responsibility and personal life. So that's the only thing they are saying, why they need to address the burnout. If we don't address the burnout, at some point of time, physician will not be capable enough to provide the care to the whole community where they are living. Or maybe at some point of time they will say, okay, I'm leaving medicine because I cannot handle things anymore. So that will also decrease the number of providers into the healthcare system, and that will also increase the burden on the community basis, that they don't have the access to the care. So that's why addressing burnout, solving the problems to decrease the burnout, or maybe trying to address the burnout would be one of the best thing for the patient care, as well as at the same time for the self care of the physicians. While it can be accidentally difficult to make necessary changes, we know we need tangible steps to promote wellness can include not treating oneself, and instead having a family physician and discussing stress and other health concerns with them. Yesterday when we were talking about the physician patients, we were talking that you should not treat your own family members because you can be biased, you can be having an emotional barrier. So same thing comes here. If you are having burnout, you feel, okay, I'm depressed, I am having anxiety, I am having some kinds of stuff, don't try to treat yourself, because you are not in the mental state, or you are not in the particular state to make decision for your own self. That's why one is healthcare provider, they always have a family physician who is someone else, and you can discuss the stress, and they might be help you in a better position. Reaching out to the local physicians health programs, this is everywhere in each and every province, probably everywhere is available, and these are kind of a wellness programs which helps the physician to decrease their stress at some point of time. Focusing on issues that are within one's control, such as financial decisions, work hours, bringing work home, prioritizing exercise and stress, choosing work with the supportive colleagues, etc. How you can focus on those issues which can be controlled, which can be changed, which can be improvised. So number one thing, what are your decisions on the finance part? What is your work hours? Either you want to bring some of your work at home, either you are okay to do it at home, and you should be prioritizing on your own rest, exercise, good healthy diet, choosing to work with the supportive. As you have more colleagues which are supportive, it will be very great for you to distribute or maybe try to ask for help when it's needed. De-emphasizing one's focus on issues outside of one's control. Try not to focus much on the things which is outside of your control, like you don't know what's going to happen. So that it's better that you try to do something like staffing level. At the staffing level, definitely you cannot have much control on how many staffs you have, what kinds of care are provided by the other staff members, and everything. Reimbursement programs, institutional policies, and decision. Some of the decision are made at the systemic level, so you might cannot change those. You have to follow that, either you like it or don't like it. So that's the one thing which can also be de-emphasizing one's focus. So these are all the things are coming where you can promote the wellness, what you can do, where you can do professionally, and advocating for desired changes. This is one of the things where we can say advocating for what kind of changes you want. Maybe you want a CT scan machine in next 3 months, that would be great for next 3 years. Or you want to ask for more nursing staff, you want to ask for more colleagues, or you want to ask for once a week one specialist visit. So something like that, if you try to do that, that would also, either it's being solved or not solved, it does not talking about that. They are talking about how you can ask for help, or you can try to make some changes that can really help, and that's the advocacy part. Advocacy mean you make a suggestion, you provide some kinds of education, you provide some kinds of bullet points that okay, these are the things are happening, can we make like this that can help us to solve this problem. So this is the thing, what will be the solution, it's always on the systemic level, and that's not the part of the professionalism, that is beyond your control. So I hope you like this video and it was very helpful to you. You can put your comment, maybe like or share, subscribe. One thing which I would highly encourage, that I am also an IMG. I have been educating myself how to learn the Canadian healthcare system, as everyone's goal is to enter into the Canadian system. If you find any kind of changes, or you find that if I'm wrong somewhere or I might need to improve some of the things, I would highly recommend you to put your suggestions in the comment box, so I can improvise and I can help the more IMGs I can in my at my level. Thank you so much for watching this video, and I wish you all the best for your exam. Thank you.